Couple dozen protesters showed up at Congressman LaMalfa's Reading office at noontime today, upset with President Trump's bill that would cut Medicaid payments to some recipients.
What do we want? Healthcare! When do we want it? Now!
A brief chant as the group gathered at LaMalfa's office, and they also took their message to drivers going by on Churn Creek Road. Michelle Gaffney is a nurse at Shasta Regional Medical Center. She says the majority of her patients are low-income, seniors, or both, who rely on Medicaid.
Taking away the only access they have would be devastating. They would come to the hospital sicker and have poorer outcomes. And, my job is to, get them better, to provide them with care. And so that's what brought me here.
Without the health care, people will leave. So these rural communities are going to die off. In Trinity County, for an example, in Weaverville, without the hospital, the mill will close down.
Robbie Camacho lives in a rural community. She says this could close smaller hospitals.
The cuts to Medicaid is going to devastate rural hospitals. They are, I worked for a rural hospital for many years, and I know that they are mainly dependent on their Medicaid and Medicare dollars just to stay afloat because of the high percentage of their patients being Medicare and Medicaid. So any cuts to those programs will devastate them, and it will cause closures.
I got a response from Congressman LaMalfa's Washington office, paraphrasing: Congress is phasing down and reducing taxes paid by hospitals and insurance plans that fund Medicaid. Those programs have been abused by states to pay for people who aren't supposed to be on the program. There is a $50 billion fund to ensure any impacts from the tax reduction do not hit rural hospitals in our district. And Medicaid funding and payments to hospitals are set by the state and not the federal government.